started. Good morning, everyone, and welcome to Security Health Plan Academy, our monthly webinar series designed to provide you with valuable information relevant to your health, wellness, and healthcare plan. In today's special edition session, we will focus on all the extras included with your Medicare Advantage Part D coverage. We'll show you how to get the most out of your coverage, including a real-time benefit check, 102-day extended supplies, free vaccines, affordable insulin, medication synchronization services, and so much more. We are honored to be joined by Security Health Plan Director of Pharmacy, Eileen Murphy. Eileen is focused on ensuring members have the highest quality pharmacy benefit programs possible. She has a doctorate of pharmacy from the University of Wisconsin-Madison and completed residency training in a hospital pharmacy practice. Outside of work, Eileen and her husband are busy attending their 3 children's various sports events and visiting as many national parks as possible. Eileen, thank you so much for coming on today with us and talking about this important topic. I will go ahead and hand this over to you.
Great. Thank you so much. All right, I appreciate the introduction. I'm very excited to be here today to talk to you all about your Part D plan. I'm going to provide a high-level summary of the topics on this slide. Please do make note of any questions you have, and we'll use the second half of this time to discuss those. The first topic I'll start with is real-time benefit check. So what is that? With Security Health Plan, we want to make sure you understand your benefits and you can access the coverage information you need when you need it. So there's 2 different ways to do this. The first one is on the member portal, My Security Health Plan. It's easy to understand your health benefits in real time. You can check the cost of drugs and compare drug prices between pharmacies to find the best deal for you. This tool takes into account which benefit phase you're in, whether it's early in the year and you're in the deductible phase, or if you're in a catastrophic phase, it will display what your specific cost will be today at that pharmacy for that drug, dosage form, and quantity. The same functionality is available to your doctor in the electronic health record when they are prescribing a medication in the office. This means that you can ask your doctor about the cost of a new medication while you're still there in the office, which helps you make informed decisions about your care. Your doctor can also see alternative medications and what drug tier those are on, all from within the electronic health record that they're working in. These real-time benefit checks really take the guesswork out of wondering what will the price of this drug be. And let's talk some more about choices that you have with your Part D benefits. So your prescriptions, it's your pharmacy, your choice. On the left side here, you can get up to a 102-day supply of most chronic medications from your hometown pharmacy, or you can choose mail order pharmacy services. Many members find getting extended day supply for chronic medications convenient, as it results in fewer trips to the pharmacy. Of note, you have the same copay, whether you're getting a 102-day supply or you're getting a 90-day supply. So talk to your doctor about getting a prescription written for the 102-day supply to maximize your cost savings there. On the right hand, if we talk about your pharmacy network, what about that? You can choose really whatever pharmacy you want to use within the network, whether this be a retail pharmacy or a mail order pharmacy. Our pharmacy network includes all major pharmacy chains as well as local pharmacies. You can check and view the list of network pharmacies on the website listed on the screen here. And just as a general reminder, at whatever pharmacy you choose, we always encourage you to bring into the pharmacy with you the Security Health Plan Pharmacy ID card every time when you pick up your medications. And this allows the pharmacy to verify your prescription drug coverage. And next, we're going to talk a little bit about vaccines, one of my favorite topics. So the great news is that all ACIP recommended vaccines are covered for you at $0. This means that you have no out-of-pocket costs regardless of where you get those vaccines, whether it be at the pharmacy or whether you go to your doctor's office. There are many immunization-trained pharmacies and pharmacists in the community who can make personal vaccine recommendations and administer these vaccines in the pharmacy. In addition, in Wisconsin, we have centralized vaccine records that are maintained through the Wisconsin Immunization Record to ensure coordination of care amongst all healthcare providers. Vaccines really are an example of the adage, an ounce of prevention is worth a pound of cure. Not only do you help yourself by getting routine vaccinations like the influenza vaccine, but you're also helping the whole community, as we have neighbors among us who may be immunocompromised and are more likely to develop severe illness if they get exposed to a virus, for example. Babies also don't have fully developed immune systems and aren't eligible to receive immunization such as influenza vaccine until they're 6 months older, 6 months or older. So overall, I encourage you to talk to your doctor or your pharmacist about vaccines and make sure that you're up to date on all vaccines that are recommended for you. And again, you have no out-of-pocket costs for any of these vaccines. This is the $0 vaccine benefit is available to the Medicare Advantage members who have prescription drug coverage, as this is a Part D specific benefit. Oops. All right. Switching gears and talking a little about diabetes supplies and drugs. So for our members with diabetes, we have a cap on the cost of insulin so that you won't pay more than $35 for a 1 month supply of covered insulin products in all coverage phases. This is the case for insulins that are covered under Medicare Part B. For example, if you have an insulin pump, or covered under Part D. Also covered in test strips, meters, and continuous glucose meters, or CGMs, are also covered at $0. And for more information regarding insulin products, you can click the link here and view 2024 formulary, and then choose anti-diabetic agents and then insulins to get more information. If you need help with your diabetes medications or testing supplies or have questions, please call our pharmacy benefit specialist and we can help you further. Another great tool to help simplify your pharmacy experience is a program called medication synchronization. If you haven't heard of this, this is just a way that you can have all of your chronic medications, the fills synced up so that those refills are due on the same day. This can prevent multiple trips to the pharmacy, help you from getting your prescription refills on time, and continue taking them as directed by your doctor. And to set this up, all you really need to do is talk to your pharmacy about setting it up for you. The first fill will involve getting a partial fill of some of those medications so that future fills will be all synced up. If you would like to do this, I would recommend that you give your pharmacy team advance notice because it will take a little time for them to set that up for you. Syncing your medication fills will save you time and hassle in the long run. Another question that comes up about drug coverage is what drugs are not covered under the Medicare Part D program? Especially this year, as there's been a lot of news coverage about weight loss medications, that is one of the drug categories that is not covered. So when the Part D drug program was created in 2006, certain drug categories were excluded from payment, and these are listed on the screen here. So drugs for weight loss, drugs for erectile dysfunction, drugs used for cosmetic purposes, drugs for cold and cough medications, vitamins and minerals, and all over-the-counter medications, including aspirin, are all excluded under the Part D program. So the good news, however, is that Security Health Plan offers a supplemental benefit for over-the-counter drugs, which I'll talk a little bit about on the next slide. All right, so we recognize that health and wellness is important, and we offer this over-the-counter benefit to you. Every quarter, you have a $30 credit to use for these supplies. There are nearly 200 products to choose from, and you can see what some of those items are. They're listed on the screen here. Items such as pain relievers, cough, cold, and allergy medications, diabetes management supplies, oral care, skin care, vitamins and minerals, eye care products, and blood pressure cuffs. I'm happy to share that we now have 2-day shipping through FedEx, being used as an exclusive shipping vendor. This change was made to make sure that you get the supplies faster and that you have what you need when you need it. All right, next I'm going to talk a little bit about a tool that we have to help you save money on your prescription drug costs called Rx Saving Solutions. If you missed last week's webinar, it focused on this service. If you heard last week's, this is just a repeat of that, but we partnered with a company called Rx Saving Solutions to bring you pharmacy cost savings. After you've registered for this service, you will receive personalized notifications from Rx Saving Solutions, either by text, email, or mail, when cost-saving opportunities are identified, and then you and your provider can decide on what the best option is for you, for your health and your budget. The Rx Saving Solutions free service takes the guesswork out of prescription drug pricing and offers full drug pricing transparency. I want to emphasize that there's no cost to use this service. This specialized software looks at the medications, it analyzes plan details and claims data, and finds options to save you money. You receive personalized alerts anytime there is an opportunity for you to save, and any changes are really suggestions only. So you and your provider make the final decision on any change. And even if, for example, if you are not taking any medications, if you sign up and register for the program, if an opportunity is available in the future, then you would be alerted to it should it arise if you register. This is a benefit that's available to Medicare Advantage members with prescription drug coverage. Sometimes it's good to know what kind of examples of what might happen with these switches. So some of those might be a lower cost alternative within the same class of medications, dose consolidation. So an example where you could take one tablet where you're taking 2 tablets a day, or switching to a slightly different dosage form. Maybe you're taking an ointment and there's a cream that's equally effective. So those are the types of switches that might help save money. So if you haven't already, please navigate to the site at the bottom of the screen here to activate your account and start saving. And what if you still need help paying for your prescription drug coverage? Medicare has an extra help program that helps members with limited income and resources to lower or cut Part D costs. It can help pay for your Medicare prescription drug plan costs. You must be enrolled in a Medicare prescription drug plan to get this extra help. And to be in the program, you need to meet a specified financial threshold to qualify for the program. You can apply in 2 different ways. You can go to the website, the Social Security website listed here, or you can call the 1-800 number that's listed here as well. So that's another tool that you can use to help support if you're having problems with the cost of medications. So another tool that we have is the medication, skipping gears here. So let me go back. Okay, so another, I wanted to point out we have excellent pharmacy benefit specialists that are available to help you with any questions you have about the drug program at any time. Our phone number is listed there on the screen. We're open Monday through Friday, 8 a.m. to 5 p.m. So it's when our local core team is available. We have after hours coverage at any time, but this is when our local team is available. So I'd recommend that you call us. If you have any problems, we can help you get it resolved quickly. There are some times when the plan might be reaching out to you. So our friendly pharmacy technicians or pharmacists may be calling you if you qualify for the medication therapy management program. This is a program for members who have multiple health conditions and are taking multiple chronic medications. Our pharmacy team and or our partner Clarest Health will reach out telephonically to complete what's called an annual medication review. This is a service that is designed to really focus on what is most important to you and what is concerning you at that time. For example, are you having any problems getting your medications due to the high costs? Are there any barriers you're having with your care? Are you experiencing any side effects from your medications? Are you concerned about any drug interactions? This is a free service to you. The clinical team coordinates care with your doctors. And after the call, you will receive a printed medication list and a medication action plan, which summarizes what that conversation with your doctor, with the pharmacist was, so that you can bring it to your doctor's appointment. Another thing I wanted to comment on is we acknowledge that accepting a call from someone you don't know and you haven't met, maybe, maybe met with a little bit of healthy skepticism. So if you're ever wondering whether a caller is legitimate, please give us a call to confirm whether that call is made on behalf of Security Health Plan or is from Security Health Plan. Another tool that we help to help members with this is we added to our website a list of our vendor partners where you can go to our website and look at the list of vendor partners and read about who they are and why they might be contacting you. And that would include like ARC Savings Solutions is listed there, Clarest Health, who helps us with the medication therapy management program, is listed there as well. Okay, lastly, I wanted to give a little bit of a preview of what's next for the Part D program. So CMS is changing the Part D program design next year. So as part of this overall program redesign, there will be several changes. One of which is the maximum amount that a member will pay out of pocket for Part D drugs is $2,000. Second one is that the infamous gap phase, or donut hole as it's called, is being eliminated completely. And third is that there will be no member cost share in the catastrophic phase. So currently there's a 5% coinsurance in that phase. So those are three of the major structural changes in the Part D program at a federal level coming in next year. And that's going to conclude some of the high-level overview of some of the programs that we offer. And I'd like to open it up for questions at this time.
Sure. And if anybody has a question, you're welcome to submit that via the chat feature, which is located toward the bottom of your screen. I do have one that we can start off with. So the first one I have for you, Eileen, is if I call Security Health Plan, can you or someone in customer service help me find the lowest copay for my prescription refill?
Yes, absolutely. That's a great that's a great question. So we absolutely can help you with that question. We can help show you where you can find that information on your own as well through the member portal. So absolutely.
Perfect. Another question that we have, if someone is already seeing their healthcare provider routinely, should they call Security Health Plan for a medication review?
For the MTM program. So the MTM program is a program that is not broadly used for everyone. It's only certain people that qualify for it. So we would try to reach out to you if you qualify for the program. So I would wait to hear from us, I guess, and then and go through it that way. So it's not so much that you could call us and ask if you qualify for the program, I guess, if you're wondering, or if you have a specific question. We do have pharmacists on the team that can help you at any time. So the program itself is designed for, as I mentioned, these members who have multiple health conditions and are taking multiple chronic diseases. And we will start an outreach program, once the year begins. So we'll be trying to contact you. But if you're not qualified for that program and we're not contacting you, you can always ask us a specific question if you need support in some way.
All right. Well, I'm not seeing anything come through the chat feature, so we can go ahead and wrap this one up. But if anybody who is on the call today or sees the recording at a later date has questions, you're more than welcome to reach out and we can get those answered for you. Thank you, Eileen, for joining today and presenting. We are so fortunate to have you here, and you've been a wonderful resource for our members. So thank you so much.
Thank you.
All right. Be well, everybody. Thank you.
Bye.